Okay, how many of you have an overwhelming desire to talk to somebody about what you've just heard? Gabi, please come on up. Gabi Cuff is someone that many of you in this community of practitioners will know very well. She is the Director for Leadership and Talent at Fraser Health, and she is the best facilitator I have ever seen in action. So get ready for a treat and get ready to engage. Gabi.
Thank you. Wow, now you're going to have certain expectations, aren't you? Good morning. It's my deep privilege to now just guide you through a chance to look inside, and you've already had a chance this morning to do that, beautifully led, thank you. But a chance to talk a little bit about what's just occurred for you as you've listened this morning. I took a minute to look at the definition of provoke. You know, I use words a lot where I go, well, what does that actually mean? I use it and what's the deep meaning of that? There's several things that I saw. To call forth, to arouse to a feeling or action, to push something to happen, to annoy, to vex, stimulate or give rise to. And then it also said typically a strong or unwelcome one. I noticed that I've had a whole range of experiences this morning as I've listened. I've been provoked. And so I want to invite you to be willing to be vulnerable yourselves and think about what has stirred for you and that you're willing to actually share and talk about to possibly strangers at your table. And also understand, what is my part in this big system? Because you are in a system, aren't you? You are in a system, and then there's you. There's you showing up every day. There's me showing up every day. So I'm going to ask you to do a few things this morning, and I'm also in the mode of adaptability, because just like it happens in your day every day, you have this planned agenda, and then things change, don't they? And you're behind time. So here's what I'm going to be doing this morning now, is changing a little bit of what my timing is so that you do get a break. So my goal is still to send you to break at 10:30 as planned, but I have less than half the time left in terms of what I was going to be doing with you. So that's okay, right? Because we're used to that. We know how to do that. So how at your table might you say your name and your role and share two things that you bring to the table every day that you do because they make a difference to the care for the people that you serve. So it can only be like a quick sentence that says, I do this and I do this. This is what I bring. So at your tables, with some beautiful facilitators, every table has a facilitator who put their hand up today, who's going to serve in a particular way today. At your table, they'll introduce themselves, they have a role to play, and then this afternoon they're bringing everything they've learned to guide you through some more conversation. So I want to appreciate people who said yes to that today. But at your tables, this is the first invitation. If you haven't had a chance to meet everyone, what's your name, your role, and what are two things that you bring to the table in one sentence? Okay? Go. And I'll use a bell to bring you back in a few minutes, okay? Enjoy that conversation. I hope you all had a chance to hear who's at the table with you. No. All right. Well, I'll let you finish that up, and there are some tables who are complete with that first round. Here is the second question or dialogue in front of you. As you reflect on this morning, I know I heard a lot. What did you hear? What are some key challenges in your work? What occurs for you in your world as it relates to this topic? This world of bringing compassion, working with people who are obviously showing up in your world because they're not feeling on top of the world in terms of their health and wellness. They're in your world for a reason. So what are some of your key challenges? And so this is, again, the bit of change up I'm going to invite you to, that you actually talk to one person beside you, not the whole table. So you've got 5 minutes right now to just share with one person, what are some of the key challenges in your work? And I'm just going to invite you to not be at the whole table right now for this first round, right? Just talk to one other person. If it makes sense that it's 3 of you, well then of course it'll be 3 of you, but one other person. And if you're somehow the odd man out at your table, everyone's turned to someone else and you're just sitting there, well then be resourceful, you know, go over to the next table and find someone who's also sitting there by themselves, okay? So here's the next conversation. Key challenges in your work. 5 minutes, go. I had a few conversations at break, and so the intel that I've gathered, without any change in the theme, was how deeply inspiring, provoking, rich this morning had been already, and that if it was over now, it would have been worth it. Okay? Yeah. And it's not, right? So there's more conversation. You know, whenever these kinds of opportunities are set up, there's a number of things at play. And I'm going to break it down simply like this. There's kind of like committed speaking. When it's my chance to speak and there's such little time, what will I contribute to the table? And then, of course, I judge. Is it valuable? Is it worth it? Is what I have to bring something that's going to be important in terms of a contribution? But how do I be a committed speaker? And then there's the really other important side, which is how can I be a committed listener? Because now everyone else has something to say too. And that takes a particular kind of like switch, I notice, for myself. I want to be a committed listener. And so I'm going to suggest this. This is part of your work every day, being a committed listener. It's part of being compassionate, is to actually be in the practice of when someone is speaking, actually looking at them. I know it's an interesting concept, isn't it? But be very purposeful about, as a committed listener, when someone at your table or someone is speaking, that you're actually looking at them. And you notice there's so many other things to look at, right? We now have like blackberries and things to look at when someone is speaking. So I'm just going to also just evoke that part of you. Bring a committed listening as you now, at your tables, again, there's not enough time. We're going to give you 5 minutes to just hear a little bit from each other. What are some of the key challenges that you face in your world? And listen for how they're same and different. And because we're all having an experience and all having a different one, they're all a bit same and different, aren't they? So 5 minutes at your table to share as a whole table some key challenges. Knowing, of course, you can't tell the whole story about it in a sentence or two. Okay, so enjoy that. 5 minutes, go ahead. Is the room big enough to hold all the challenges? Did you hear what's same and different? Soon after the ice storm that we experienced here on the Lower Mainland, I went for a very early morning hike on a Sunday morning with my camera. I don't usually take my camera with me so I can take pictures of signs. This sign was on one of the paths. I walked past it at first. There were no workmen working, but then I stopped and went, I have never seen a sign like that. It says, make eye contact before passing. And then I stood in front of that sign for quite a while and decided, I'm going to take a picture of that because I wonder what that would be like if everyone in healthcare made eye contact before passing. What would that be like if I actually saw you and you saw me, which then leads into the next conversation. We heard this morning that we have biases. Oh, that's so shocking, isn't it? You and me, we bring biases into our work. And I think this is one that I used to carry, and I still do. I walk past people because what can I do? The homeless person sitting there, the person that's looking for money, the drug addict, the alcoholic, the homeless person, the emergency department. There's too many people there. If I make eye contact, they're going to ask me a question. They're going to want something. Let's not look at that family, because every time they come, they have so many questions and so many things they're asking me. And to confront that, to understand that that is a bias, or some other word for it, but it gets in the way, doesn't it? So, here's a chance to look quite deep. It's not like we're just starting. I think the whole morning has invited that. The provocation, the poking, and the provoking. So, I'm just going to give you 1 minute. Again, we're shortening here. Because if I really wanted to be able to touch them all and really make like friends with the biases that I had so that I could actually understand them, it would take more than a minute, wouldn't it? It would take, well, it's my lifetime work, I think. Yeah. So we're just going to sit quietly as a room, as individuals, as teams, as systems, as communities, and be willing to look. What are some of my personal biases? We have good ones, right, that contribute, that have us lean into the work that we do. I find it's the ones that I label negative. Then we get into a whole conversation about what does that mean, good or bad, positive or negative in terms of a bias. But this bias that we're talking about right now shows up in my work in a certain way. If you would find, again, one other person that you'd be willing to just share, like, these are some of my biases, the good, bad, and the ugly of them, and how they show up in my work. 4 minutes with another person. Step into it, please. Go ahead. This is the rough part of a facilitator's job, is actually asking people to put a period on the end of a really important conversation. So just think about what you heard. Was there something you learned about yourself? Did you see the human part of yourself and the other person? Now at your tables, what are you willing to put on the table? Let's see what we can harvest together as we share. What are some of the personal biases that come into play in your work? Whether they live at the level of individual, at the level of team, which we also heard about this morning. We have group biases. We have stories about each other. Those doctors. Whoops, did I just say that? Those social workers, those nurses, those community care providers, those people. Yeah. So at your tables, please. Again, it's only 5 minutes. Speak and listen richly. Go ahead, please. Yeah. Thank you. Just as lily pads start under the water, I was enjoying these the other day, watching them emerge. They're going to turn color. They're going to be different once they are above the water and floating. But they have to start under the water. And that's kind of where we're looking right now. What's under the water? What's there? Because often we just see what's on the top. What's there? So we're moving into this conversation. There's white cards on the table. If you haven't noticed them yet, you can, facilitators, if you want to ensure that they're distributed. You know, sometimes you might feel quite alone in your work, and other times you wish you could be a bit more alone. But you bring care to our patients, clients, residents, to our vulnerable populations with other people, and we're noticing, you know, how connected we are in our communities. We're leading into conversations together now in different ways than we used to. We're meeting different people in our hospital sites than we used to talk about how we collectively bring what we know and what we don't know. So what is important about how we work together with the other people who provide care? What are the values that we consider when we're doing that? What are the words? How do we language around this? Again, just thinking for a minute on your own about that. What are the words, the values? How do they guide your practice? When you're ready, you can put them on the paper, or you can wait until you've had a bit more conversation because you just want to explore them a bit more. So don't be so quick to say, here they are, because maybe you have something else that wants to emerge for you. So just changing the dynamics a little bit, doing things in threes, 3 words, 3 people. So you've had possibly the same partner to have these dyad conversations with, and now just look how you might just change things up a bit and make it a threesome. Okay? 2 other people that you're going to talk to. Maybe it means you're like talking to the person beside you on the other table, who knows, right? But form little groups of 3 and share these values with 2 other people. So again, just a few minutes for that conversation. So find 2 other people around your table you haven't talked to yet. You could stand up and have this conversation. You don't have to stay sitting. Go ahead, please. 5 minutes. Last conversation. You have yellow cards on your table. Now, it says 1 word per card, but a strategy in 1 word is likely going to be a challenge. So I'm just going to reframe and say 1 strategy per card rather than 1 word per card. What are we doing? What are you doing, we doing, that lives up to our values, and or what should we do differently? So are there things that we say, yeah, we're doing a pretty good job of that, let's do more of that? Or are there gaps there that you say, oh, if we could bring that, that would shift something, that would make a difference? Pretty important conversation, isn't it? So that's our last conversation before I hand you off to the next item on our agenda. So just going to invite you to think individually what that might look like. So at your tables, and when you see that people are ready to talk at your tables, just engage at your tables around this last conversation, please. Knowing, of course, that in the best world, you're leaving your card on the table, and we get to collect that. That's the goal, right? So write in such a way that someone else can read it. 1 strategy per card. Go ahead, please. 5 minutes. Thank you. Thank you. There's always more to say, isn't there? So the white cards for the values, the yellow cards for the strategies. If you have something else occur to you, you can write that on there, but if you would leave those on the table. I need to pass the baton on to the next item. So first, I just want to acknowledge all of you for leading into the conversation, for bringing your listening and your speaking and your care. And if you would also please just put your hands together and thank the facilitators at each table. Thank you. I'm just going to leave you with this slide again. Noticing, of course, that the word pass is in the word compassion. And when I pass, in whatever way that I am with you, just going to just leave that little bit with you. The word come shows up for me too. I'm going to come and pass through this with you. That means I'm going to see you. I'm going to make eye contact with you. I think this is a great sign to put all over the place, don't you? Yeah, not just in the forest for people who are clearing the paths so that I can walk there. Thank you for your attention and your time. It's a privilege for me. Thank you.